of you a straw, and I want you to either during my speech or periodically during my speech try to breathe through that straw. And I'll tell you what it's for at the end of my speech. I'm sure you've all heard of a disease called cystic fibrosis. But how much do you really know about the disease? Probably about as much as I did about a year ago when I found out I could actually be a carrier for this disease. I thought it was a disease that only affected the lungs, but I found out it goes much deeper than that. Most of you know my daughter, and most of you know my grandson was diagnosed with this disease when he was 2 weeks old. I know sometimes it's hard to ask questions about things like this, so I thought I would tell you a little more about it today. My presentation is going to tell you what CF is, how it's diagnosed, and the symptoms and treatments of the disease. If you will or will not have cystic fibrosis is determined at conception. According to CFF.org, both parents must be carriers of this genetic defect in order for a baby to get the disease. And still there is only a 25% chance that the child will have it. There's a 50% chance it'll be a carrier and a 25% chance it won't be affected at all. Cystic fibrosis is defined by Cunningham and Taussig in the book An Introduction to Cystic Fibrosis as an inherited genetic disease that causes the exocrine glands to not work properly. Normally these glands make a slippery secretion that help with your body functions. In CF patients, the secretions it makes are thick and sticky. Tears, digestive juices, sweat, and mucus are some of these secretions. When these become thick and sticky, instead of helping, they actually plug your ducts and passageways. They can also affect the sweat glands by causing the sodium in your sweat to be much higher than normal. Cystic fibrosis is not a new disease. There's cases that date back to 1959. Every year, 800 to 900 people in the U.S. are diagnosed with this disease, and 1 in 31 people are actually silent carriers of this disease without ever knowing. There are 1,700 known mutations of this disease. How is it diagnosed? Newborns nationwide are tested at birth for the presence of this disease. This test can show a lot of false positives though. It can show false negatives, and it can show a positive for a carrier of the disease. So if a positive result is found, they then do a simple sweat test. It's inexpensive and painless, but it simply shows that there's a higher level of sodium chloride in the baby's sweat or salt. This test shows that the mutation is present, but it doesn't show the severity of the disease. If a child is diagnosed with it, some or all the following body functions can be affected. A parent is actually one of the first people to know if the sweat glands are affected, because when you kiss your child, it will actually taste salty and you'll feel it on your lips. Sounds kind of crazy, but it's true. This rapid loss of salt causes dehydration and heat stroke faster than in an average person. Treatment for this is simply drinking lots of water when it's hot and carrying a salt shaker with you. Cystic fibrosis patients are rarely asked to limit their salt intake. The respiratory system is probably the most severely affected system that this disease affects, and it actually determines how well the patient will do and how long they will live. Your lung secretions normally help you get germs and dust out of you, but in a cystic fibrosis patient, that mucus holds it in and actually causes a plug in your lungs, which in turn causes an infection. Your sinuses are also affected because of the thick, sticky mucus. Wheezing, coughing, shortness of breath are all symptoms. The treatments for this are airway clearance, either by manual chest percussions, or they actually have a vest that the child can wear that shakes the secretions out of it. Inhaled medications that open your airways and thin the mucus are also used. The other system it affects is the gastrointestinal or digestive system. In a normal person, our pancreas creates enzymes which help us absorb and digest our food. In the CF patient, these enzymes are produced, but they can't get out of the pancreas because of the thick mucus. This can lead to malabsorption and blockage of the intestines. It can also cause a unique form of diabetes, which is actually a combination of like type 1 and type 2 diabetes. And they think that's caused from the pancreatic scarring. Treatments for this part of the disease are the patient patient has to take an enzyme every time it eats to help with the absorption of food and vitamins, especially the fat-soluble ones. Cystic fibrosis has no cure, and a diagnosis of cystic fibrosis changes a family's life forever. Treatments today, however, have changed, and the prognosis is way better than it was 30 years ago. Ongoing research to improve treatments and research actually to target the genetic defect are being done every day. In fact, in 1962, the mean survival rate was 10 years old. And according to cysticfibrosisnewstoday.org, the average life expectancy is now about 37 if a child makes it through childhood. Cystic fibrosis affects many more areas in the body than the respiratory system. I hope you learned more about what it is, how it's diagnosed, and the symptoms and treatments of it. At the beginning of my speech, I gave you all a straw and asked you to breathe through it for a short period of time or a long period of time. For a cystic fibrosis patient, this is what breathing is like all the time. And I hope with all the new treatments and cures that they're researching, that people with cystic fibrosis can have an easier way to breathe. And I hope my grandson may